All right. My name is Dr. Risang, and I'm a cardiologist now. I'm just using this opportunity to talk about the heart and prevention. So, when it comes to prevention, why is it important? One of the things that people need to understand is that prevention is a lot better, a lot easier, a lot cheaper than treatment. So, if you can think that you have risk factors for heart disease, whether it's hypertension, high cholesterol, diabetes, being overweight. If you treat those risk factors, it's gonna do you a lot better in the future than having to treat that stroke, having to treat that um, um, congestive heart failure, treat that heart attack. So knowing these risk factors, knowing that they can potentially lead to something drastic happening in the future, such as a heart attack, is extremely important. So what exactly is a heart attack? It's when that artery in your heart, one of your heart arteries occludes, and you can have symptoms of heart attack early on to let you know that you're having one, or let you know that you are at risk of having one. Things like chest pain can be very significant, can be gruesome, especially when the pain is worse with exertion. Pain that gets better with a medication called nitroglycerin can also be helpful. So just know that those are the classic signs when it comes to someone having heart conditions such as a heart attack. Chest pain here, pain that moves to the shoulder or to the arm, associated with sweating, associated with nausea and vomiting. All of those are concerning that someone may be having a heart attack. So what can you do when this happens? One of the things is going to the hospital as soon as possible. Ideally, you don't want someone to be driving. You want them to call 911 to get the EMTs there, just in case if you have something dangerous such as a fainting spell while driving can be life-threatening, life-ending. So someone has chest pain, someone has enough risk factors like I previously said, such as high cholesterol, diabetes, hypertension, a strong family history, smoking. Send them to the hospital to do the appropriate testing. They get blood work such as a troponin level, which is leaked when the heart is under some trouble, such as a heart attack. They can also get an EKG, which lets you see if there's any electrical signs, electrical signals that is concerning for a heart attack. Um, but also a good history. Depending on risk factors associated with it, we can rush someone to get a cardiac catheterization where we directly visualize the heart arteries to make sure that you're not having a heart attack. If there is blockage, a stent will be put in. If there are significant blockages or blockages in scary areas, especially if you have an underlying history of heart disease, then we will likely not proceed with stent placement, but stop what we're doing. Make sure that you're up and awake and discuss possibly having CABG, which stands for coronary artery bypass graft. This is done typically by the CT surgeons. So, boom. So you've done all of these testings. On the other hand, let's say that some of your symptoms are not classical for chest pain, not classical for someone having a heart attack. What else can you do? You can do a stress test. You can do an echocardiogram, an ultrasound of the heart, or you can just monitor them overnight. Make sure that those cardiac enzymes don't get worse. Make sure that their symptoms don't get worse. Treat them appropriately. If they have hypertension, treat their blood pressure. If they have excess fluid in the legs, treat that with diuretics. Something like a furosemide or a Bumex can be very helpful. Um, a lot of times, if everything has been done and you cannot find a cause for it, then we want to have them follow up on an outpatient basis to see if there's anything that can be done, anything that can explain the symptoms, whether it's not a heart attack, can other things be causing this? Can it be reflux? Um, but if everything is unremarkable, if everything comes back normal, then we have to do our due diligence and look for other potential non-cardiac causes. Sometimes this can be very difficult for people to understand that Not everything that's quote unquote chest pain is coming from the heart. You can have reflux, you can have issues with your gallbladder, you can have issues with your pancreas, you can have um, issues with the chest wall cartilage itself that can cause chest pain. So if all the dangerous things have been ruled out, a good follow-up on an outpatient basis, then we have to consider that there may be other potential non-cardiac causes of this. Now going to the looking at some of the risk factors for heart disease, one of the biggest ones being hypertension, hypertension or high blood pressure. What exactly is hypertension? What is high blood pressure? Well, there's pre-hypertension when that top number is between 120 and 130, or the bottom number 80 to 89. Stage 1 is 140 or 130 or above, and stage 2 is 140 or above. The reason that we have these stages is because if you have stage 2, you may need to be on multiple medications for this, in addition to the lifestyle changes that are associated with it. So you have high blood pressure. What are these lifestyle changes that can be done? You can do things like exercising. American Heart Association recommends 150 minutes of moderate intensity activity each and every week. If you can do a little bit more, such as high intensity activities, then this cuts it down to about 75 minutes. Once again, consistency is key. So exercising, losing weight. If you are overweight, for every 2.2 pounds you lose, you can expect that top number to be reduced by anywhere from 0.5 millimeters of mercury upwards to 2. So it can do a due diligence it can do a significant, it can be a significant benefit to you if you can lose close to 20 pounds. Your blood pressure can be reduced as much as, going from 140 to 130 to even 140 to 120. So in addition to exercise, what else can we do? Watching what you're eating, the amount of processed foods that contain a whole lot of salt. You want to be wary of this. You want to be watching, making sure that you're not doing this on a consistent basis, because it can make it very difficult to treat your blood pressure when you're adding foods that can raise the blood pressure even higher. Stress is a huge component of high blood pressure. So making sure that you're getting enough sleep, making sure you're doing relaxing activities, whether that's exercising, yoga, meditating, or just resting itself. One of the biggest things is making sure that something else isn't causing your blood pressure to be elevated. This is known as secondary hypertension. So things like sleep apnea, issues with the kidneys, with the adrenal glands, with hormones can be a huge trigger for this. So if you have any underlying issues, if you treat that, you can potentially treat the blood pressure. In the United States and probably worldwide, one of the biggest things that can lead to difficult to control hypertension is sleep apnea. For a lot of people, when they get that sleep apnea treated, they can potentially come off some of these medications. They can also potentially reduce the amount of medications that they're taking overall. Sleep apnea does a drastic effect on all the organs, whether it's the kidneys, the heart itself can lead to atrial fibrillation, significant heart rhythm issues, PACs, PVCs. So treating that sleep apnea is one of the biggest things that we can do for someone's blood pressure, but overall health. I think that's it for today. 10 minutes of just trying to answer questions. There's no one on here. I've been talking to myself for 10 minutes, but I'm going to keep on doing this, hopefully over time with consistency, see some more see people come in here and not just for 10 seconds, answering questions regarding their heart, health, and prevention.